Generalized Anxiety Disorder, or GAD, is when worry becomes a constant, unwelcome companion. Imagine your mind stuck on a what-if channel, always anticipating disaster, even when there's no real reason. GAD isn't just mental. It affects your whole body: muscle tension, fatigue, trouble sleeping, and even stomach aches or headaches. People with GAD often avoid situations, overplan, or seek constant reassurance, trying to manage uncertainty but only fueling more anxiety. This cycle impacts relationships, work, and overall quality of life. GAD is a real, treatable medical condition rooted in brain function, not a personal weakness. Recognizing these symptoms is the first step toward getting help and restoring balance. The prefrontal cortex, or PFC, is your brain's CEO. It plans, solves problems, and regulates emotions. It acts as a brake on the amygdala, your internal alarm system that triggers the fight-or-flight response. When the PFC works well, it keeps worries in perspective and helps you respond thoughtfully, not just react. This is called top-down control, your rational brain managing your emotional brain. A strong PFC lets you recognize anxious thoughts as just thoughts, not reality. Self-regulation is key to mental well-being. It's not about eliminating worry, but managing it. With a healthy PFC, you can face challenges with calm and clarity. The goal isn't zero anxiety, but having the tools to keep it in check. In GAD, the PFC's control over the amygdala weakens, so the brain's alarm system stays stuck on high alert. The dorsolateral PFC, which helps with flexible thinking, is less active, making it hard to break out of worry loops. The ventromedial PFC, which tells us when things are safe, has weaker connections to the amygdala, so even familiar situations feel threatening. The anterior cingulate cortex, or ACC, becomes overactive, keeping your mind locked on potential threats. These changes mean small worries can spiral, and it's tough to shift focus away from anxiety. The brain's threat system is in overdrive and the off switch isn't working. That's why GAD feels so relentless and hard to control. Understanding these brain circuits helps us target treatment more effectively. The brain is adaptable. Neuroplasticity means we can strengthen the PFC and improve anxiety control. Cognitive behavioral therapy, CBT, trains you to challenge and reframe anxious thoughts, exercising the PFC. Mindfulness meditation and deep breathing help the PFC calm the amygdala, building emotional resilience. Good sleep and nutrition are essential. Rested, nourished brains regulate emotions better. Advanced therapies like neurofeedback and transcranial magnetic stimulation, TMS, can directly target brain activity for those needing extra support. These strategies help retrain your brain's worry circuits. With practice, you can build a more resilient, balanced mind. There's real hope for change, even with severe anxiety. Neuroscience shows GAD is rooted in brain circuits, not character flaws. Understanding the PFC's role empowers us to use targeted therapies, CBT, mindfulness, and even brain-based treatments to retrain our minds. This knowledge turns vague advice into concrete, brain-building exercises. As science advances, treatments will become more personalized, matching therapies to each person's unique brain patterns. Compassion grows when we see anxiety as a biological struggle, not a weakness. With the right tools, we can calm the storm within and reclaim peace. Science lights the way to real hope and lasting well-being.